Hello, welcome to part 46 of Clinical Physiotherapy MCQ series. Here we gon discuss day-to-day clinical scenario with detailed explanation. Now don't waste our time, let's move to question number 226. A physical therapist is performing a treadmill exercise stress test using the Bruce protocol. During stage 3 of the test, the P wave increases in height and the ST segment begins to become significantly upsloping. What is the most appropriate course of action? Option A, stop the test and refer patient to a physician. Option B, lower the stage back to stage 2 and monitor for improved electrocardiographic indicators. Option C, continue with the test without any modification, monitoring for symptoms of cardiac distress. Option D, discontinue the test and monitor the patient's vital signs for 10 minutes. And the answer is Option C, continue with the test without any modification, monitoring for symptoms of cardiac distress. Explanation for this question is, answer C, both of these signs are normal responses to the stress test. While option A, the Bruce protocol for an exercise stress test involves using a 12-lead ECG monitor to evaluate the amount of stress placed on the heart, you would stop the test if there was ST elevation or depression, or the signs of a number of other ECG signs. P wave increases and ST upsloping are normal responses to a stress test. And option B, this is not appropriate for the Bruce protocol. And option D, if the patient requested to stop, this would be the appropriate action. Because it is not mentioned in the question, this is not the most appropriate course of action. Now let's move to question number 227. On the first day following a patient's total knee arthroplasty, a physical therapist begins treating the patient with a continuous passive motion device with a setting of 0 degrees to 40 degrees of motion. Which of the following reasons for using a continuous passive motion device is most appropriate for this patient? Option A, to decrease length of the patient's hospital stay. Option B, to decrease incidence of deep vein thrombosis. Option C, to help the patient regain knee flexion. Option D, to prevent knee flexion contracture. And the answer is Option C, to help the patient regain knee flexion. Explanation for this question is, there is no clear evidence that a continuous passive motion device reduces hospital stay or prevents deep vein thrombosis. Evidence suggests that a continuous passive motion device can help the patient to regain knee flexion. If the knee is not placed in full extension outside the continuous passive motion device unit, a knee flexion contracture may result. Now let's move question number 228. A physical therapist is examining a patient for possible lower extremity weakness. Passive range of motion is within normal limits. The patient is seated. When the patient tries to dorsiflex and invert the right foot, the patient is unable to move it through the full range of motion and is unable to take any resistance applied by the therapist. During the subsequent gait examination, the therapist should expect the patient to display which of the following gait patterns? Option A, normal gait with no deviations. Option B, increased right hip flexion during the mid-swing phase. Option C, throwing the trunk backward on the right side shortly after heel strike, initial contact. Option D, laterally bending toward the right side during mid-stance. And the answer is Option B, increased right hip flexion during the mid-swing phase. Explanation for this question is, the anterior tibialis showed poor, 2/5 grade strength during the examination. Because this muscle is active during swing phase of gait and shortly after initial contact, one would expect to see gait deviations showing up at those times. Specifically, the anterior tibialis maintains dorsiflexion of the foot during swing phase and controls plantar flexion after initial contact. During the swing phase, weakness of the anterior tibialis would cause the patient to increase the amount of hip and knee flexion to prevent toe drag. With weak hip abductors, the patient would be expected to have excessive pelvic rotation. To compensate, the patient would laterally bend toward the weak, right, side during mid-stance to help prevent the excessive hip drop. Throwing the trunk backward after initial contact may be due to weakness of the hip extensors, gluteus maximus. Now let's move to question number 229. A patient is receiving cardiac rehab and has a heart rate of 110 during moderate intensity exercise. The patient reports a 16 on the BOG RPE scale. Which class of heart medications is most likely present? Option A, beta blockers. Option B, angiotensin converting enzyme ACE inhibitors. Option C, calcium channel blockers. Option D, angiotensin 2 receptor blockers. And the answer is option A, beta blockers. Explanation for this question is: beta blockers work on the beta-adrenergic receptors to decrease sympathetic responses to stress, primarily the heart rate. The BOG scale should represent heart rate divided by 10. Thus there is a disparity in heart rate and exertion, indicating a blunted heart rate. Option B, ACE inhibitors block the angiotensin converting enzyme to prevent vessel constriction during sympathetic responses to stress, primarily blood pressure. Option C, calcium channel blockers work on the heart musculature to decrease the force of contraction, as well as decreasing the vasoconstrictive smooth muscle in the arteries. The primary response is decreased blood pressure. Option D, angiotensin 2 receptor blockers do not prevent the angiotensin I to angiotensin 2 conversion. Rather, they block the receptors of angiotensin 2 and have an effect similar to the ACE inhibitors. Now let's move to question number 230. With a traction injury to the anterior division of the brachial plexus, you would expect to see weakness of the elbow flexors, wrist flexors and forearm pronators. You would also expect to find additional weakness in option A, forearm supination, option B, lateral rotation of the shoulder, option C, thumb abduction, option D, wrist extension. And the answer is option C, thumb abduction. Explanation for this question is: thumb abductors are innervated by the median nerve, primarily by the C6 nerve root. The anterior divisions contribute to nerves that primarily serve flexors, and in this case, the thumb. So, that's all for today. If you have any doubts, please comment below. I think you have learned something valuable today. See you on the next part, that's part 47. See you till then, bye bye.